Welcome back to our stem cell series. This is video number 2. And by the end of it, you'll have a much clearer understanding of which type of stem cell therapy may be right for you and your condition. We're starting with the basics. What stem cells actually are, explained in plain language. If you rather skip ahead to where we start comparing the different types of stem cells and when each is used, just jump to the timestamp shown on screen. And so, if you're only interested in a specific type of stem cell, I've included timestamps also for that. Each of the 6 types we'll cover today so you can go straight to the one you want. So let's start here. What exactly is a stem cell? This isn't going to be an embryology lecture, and I'm not going to bury you in medical jargon. We're going to be practical. We're only talking about the types of stem cells used in real-world regenerative therapies, the same ones you're probably being offered in clinics around the world. Think of a stem cell as a master cell. It can turn into other types of cells, release powerful signals, and tell your body to repair, calm inflammation, and restore function. That's why people are excited about them. But here's the key. Not all stem cells are the same, and not all are used the same way. In medicine classes, you'd learn about embryonic stem cells, induced pluripotent cells, hematopoietic cells, mesenchymal cells, and so on. But in real-life clinical practice today, most legal, widely used therapies focus on a much smaller set. Cells derived from your own body, autologous, or cells derived from carefully screened donated tissue, allogenic. There are different sources, different strengths, different regulations, and that's why knowing the type matters just as much as knowing whether you're a candidate. Let's break this down one by one. I'll go over the 6 most common sources, the pros and cons of each, and the types of conditions they're typically used for. First up, we have stem cells from your own bone marrow. This is one of the oldest and most established sources. Pros, they're your own cells, so the risk of rejection or immune reaction is minimal. Collection is usually safe, done with a needle under local anesthesia. They're rich in hematopoietic and some mesenchymal cells that can help with tissue repair and immune modulation. Cons, your age and health matter. A 65-year-old's bone marrow cells are not as potent as a 25-year-old's. The number of regenerative cells is lower compared to umbilical or cord tissue cells. Extraction can be mildly painful and yields limited quantities. They are best for orthopedic problems such as mild to moderate osteoarthritis, some tendon injuries, joint pain, where there's still tissue left to repair. So next we have stem cells from your own fat tissue. Yes, your body can be a source of regenerative cells. Within the pros of these ones, we have they're easy to harvest with a small liposuction procedure. They contain a large number of mesenchymal stem cells per volume compared to bone marrow, and because they're your own cells, immune reaction risk is low. Within cons, we have regulatory gray areas. In some countries, once the fat is processed beyond a certain point, it's no longer considered a simple transplant but a drug. So rules differ. Potency still depends on your age, metabolic health, inflammation level, and they are not as well studied for systemic conditions as cord-derived cells. So what are these cells best for? Adipose-derived stem cells shine in localized orthopedic issues, like early-stage osteoarthritis in the knee, small tendon tears, or mild degenerative joint problems. Because they're injected directly into the problem area to reduce pain and improve function. They're also used in wound healing, especially for chronic or non-healing wounds, where the combination of cells and growth factors can speed repair. And in the field of cosmetic or reconstructive procedures, they're often combined with fat grafting to improve tissue survival, enhance healing after surgery, or restore volume with regenerative support. They're generally not used for systemic conditions like autoimmune diseases or neurological disorders because while they're great locally, they don't circulate or modulate the immune system as broadly as younger donor-derived cells like umbilical cord MSCs. Words adipose-derived stem cells are best when you want to target a specific area of your own body, especially when your own cells are still reasonably healthy. Then we have peripheral blood or mobilized stem cells. Less common, but worth mentioning. These are the stem cells mobilized into your blood after using certain growth factors, and then they're collected through a process similar to donating plasma. Some of the pros include no invasive bone or fat harvest, and another one is that they can yield hematopoietic cells and some regenerative cells. The cons could include limited mesenchymal content compared to bone marrow or fat, and that they're typically used in research or very specific medical contexts like blood disorders. They are best for hematology and immune reconstitution, supporting recovery after high dose therapy, like maybe the ones that can help restore blood or immune systems after chemo or radiation. And then another thing they're good for is experimental use in regenerative medicine, like some clinical trials that are exploring their potential for vascular repair or improving healing after heart attacks, strokes, or major injuries. And last but not least, combination protocols. So, in some advanced centers, mobilized cells are being combined with other types like MSCs to create hybrid therapies for complex conditions, though this is still experimental. So, outside of this context, peripheral blood or mobilized stem cells aren't mainstream for regenerative medicine yet. They are more like a bridge, useful in very specialized therapies or as a supportive component in clinical trials, but not something you typically see in a commercial stem cell clinic for knee pain or anti aging. Now we're moving into donated tissue territory. Amniotic fluid, placental tissue derived cells. This come from the amniotic sac and placenta, the protective and nourishing environment around a baby during pregnancy. After healthy, full-term births, these tissues are typically discarded. They're an incredibly rich source of growth factors, cytokines, exosomes, and extracellular matrix components that can help stimulate repair and reduce inflammation. It is important to understand that most products marketed today as amniotic stem cells or placental stem cells are not pure, live stem cells preparations. In most countries, these are classified as minimally manipulated tissue products rather than true living stem cell therapies. That means what you're actually getting is usually a cell-free or low cell count preparation, a biologically active signal boost rather than a true transplant of living mesenchymal stem cells. Because of that, their effects are more signaling based. They tell your own body to heal, to reduce inflammation, to repair tissue rather than directly replacing cells or building new tissue. This makes them an excellent adjunct to other regenerative therapies, but less effective as a standalone option for systemic or severe conditions. Within their pros, we have their young, potent tissue with high growth factor and cytokine content. Another one is that there's no harvest procedure for you. Material is donated and ethically sourced. And last but not least, we have that they're often used as an injectable for inflammation control and healing support. Within their cons, we have that true life stem cells are often not present after processing, so results can vary widely. Another one is they are considered tissue products, not approved life cell therapies in most countries. And then we have that less long term data is presented in this context compared to bone marrow or cord derived cells. So, what are they best for? First, orthopedic support. They can act as an additive or standalone injection for joints, tendons, and ligaments to reduce pain and support healing. Then we have that they're good for wound healing, especially in chronic, hard to heal wounds like diabetic ulcers or surgical wounds where inflammation control and tissue scaffolding are crucial. Then we have that they're good for adjunct in surgical or reconstructive procedures. They help improve recovery and reduce scar formation. Then we have that, yes, they are good as well for anti inflammatory boosting. They work as a local anti inflammatory agent when combined with other regenerative therapies. And then lastly, we have they're good for skin and soft tissue applications. They're sometimes used in aesthetic medicine to improve skin quality or post procedural healing. Because these products are largely cell free or contain very few viable cells, they're not typically used for systemic diseases like autoimmune disorders or neurological conditions. Think of them as a biological active patch or signal boost that enhances your body's own healing processes. They can complement through stem cell therapies beautifully, but they're not a substitute for them. Now let's talk about the two most famous and most misunderstood types of stem cells: embryonic stem cells and induced pluripotent stem cells. Embryonic stem cells are derived from very early stage embryos and are pluripotent, which means they have the ability to become virtually any cell type in the body. Induced pluripotent stem cells, or iPSCs, are only adult cells that scientists have genetically reprogrammed back into an embryonic like pluripotent state. In other words, iPSCs mimic the power of embryonic stem cells without needing an actual embryo. They're created in the lab from a patient's own skin or blood cells. Because these cell types are so powerful, they are at the frontier of regenerative medicine research. But it's critical to understand that right now, no legitimate clinic is injecting embryonic stem cells or iPSCs into patients for mainstream therapies. They're not approved for clinical use outside of tightly controlled research trials because of safety issues, including the risk of forming tumors, immune rejection, and genetic instability. So, what are the cells best for? They're good for laboratory research. They're the gold standard for studying how diseases develop, how tissues grow, how drugs work in human cells. They're good as well for disease modeling. Scientists use iPSCs to create patient-specific cell lines. For example, turning a patient's skin cell into a neuron to study Parkinson's disease in a dish. They're good for drug testing. The cells allow researchers to test new medications on human cell types without putting a patient at risk. As well, they are used in developing cell replacement therapies, mostly in early stage clinical trials. iPSCs are being investigated for creating lab grown tissues like retinal cells for macular degeneration, pancreatic cells for diabetes, or dopamine producing neurons for Parkinson's disease. What else? Well, the last but not least, personalized regenerative medicine. So, these cells in the future, iPSCs, may let us take a patient's own cells, reprogram them, generate fully compatible tissue for transplants, solving the problem of immune rejection. So, if so exciting, why not for today's patients? So, first, we have safety risks. Pluripotent cells can form tumors if not perfectly controlled. Then we have regulatory limits. No FDA or EMA approved therapies use embryonic or iPSCs for injections into patients. And let me clarify, this is not just talking about the US. Outside, it's not common to see these cells being involved in normal therapies offered at a clinic open to the public. Then we have immature technology. Scaling, purity, and cost issues still need to be solved before these cells can be used routinely in real world medicine. So, when you hear someone claiming to inject embryonic stem cells or iPSCs into patients today, that's a red flag. These cells represent the future, not the present. There where breakthroughs are happening in the lab, not the clinic. But within the next decade, the work being done could lead to entirely new categories of regenerative treatments that go beyond anything available right now. Finally, let's talk about the most in-demand type of stem cell in today's regenerative medicine market: umbilical cord-derived mesenchymal stem cell. These are collected from the Wharton's jelly and tissue of the umbilical cord after a healthy full-term birth. No harm to the mother or baby. The cord is normally discarded, but it's actually a rich source of young, highly active mesenchymal stem cells. Because they're so early in their life cycle, they've got stronger signaling ability, higher growth factor content, and more anti-inflammatory power compared to older cells taken from an adult's own body. For many patients, especially older adults or those with immune-related conditions, umbilical cord mesenchymal cells are appealing because they're off the shelf. That means no surgery to harvest your own cells, no waiting for your body to recover from a liposuction or bone marrow draw. They're already banked, tested, and ready to go. That also means you need to know the source, the lab, and the regulations. If a clinic won't show you their certificates or testing protocols, that's not a good sign. So, what are these cells best for? First, we have systemic autoimmune and inflammatory conditions. Conditions like lupus, rheumatoid arthritis, Crohn's disease, or multiple sclerosis are being studied with these types of stem cells because they're strong immunomodulatory effects. The cells can help calm an overactive immune system and reduce widespread inflammation. Then we have neurological and neurodevelopmental conditions under study. Things like autism spectrum disorder, cerebral palsy, post-stroke recovery, traumatic brain injury, These are areas where these cells are being researched, and they're not cures, but they may improve quality of life by reducing neuroinflammation and improving cellular communication in the nervous system. Then we have that they're good for cases where the patient's own cells are weak or compromised. Older patients, those with chronic illness, or people who have been on long term medications may have lower quality stem cells of their own. UC-MSCs offer a way to bypass that limitation by providing a younger cell source. Another thing they might be good for is immune system support and post-infection recovery. Some clinics use these cells to help patients recover from chronic post-viral fatigue or systemic inflammation after infections. Then we have sexual wellness, sometimes combined with PRP, which is platelet-rich plasma. These protocols improve blood flow and tissue quality in sexual wellness applications. Results here are more subtle than the hype, but can enhance sensation, vascularity, or erectile function. And lastly, we have that they're good for cosmetic and skin rejuvenation. Used in facial injections or microneedling to improve skin texture, reduce fine lines, and enhance healing after aesthetic procedures. So, what do the stem cells have in their favor? This type of stem cells, they're composed of younger cells, stronger signals. Umbilical cord MSCs, they are less aged, they are more potent compared to adult-derived cells. As well, they have low immunogenicity. They're generally well tolerated even when used allogenically, which is from a donor. And the third thing that they have in their favor is that they're ready to use. There's no invasive harvest procedure for the patient. Then we flip the coin and we have the limitations of this type of stem cells. The first one being it's not a cure-all. Like any stem cell therapy, results depend on the condition, severity, dosing, and supportive care. We have as well with the stem cells, the regulation varies. In some countries, these products are tightly regulated, in others, they're less so. But quality and viability can differ dramatically from one supplier to another because the use of different labs to provide a stem cell to the patient. And this is why the next one is very important, the need for transparency. We always have to request certificates of analysis, sterility reports, viability testing from the lab supplying the cells. So, umbilical cord mesenchymal stem cells are one of the most versatile and powerful tools in regenerative medicine today, but only in the right hands. Think of them as a high octane boost for inflammation control and tissue support, but not a magic wand. When sourced and used properly, they can offer benefits that older or weaker stem cell sources simply cannot match. Having analyzed all of these types of stem cells, which stem cell is right for you? So I'm going to give you a few scenarios. Let's say you're younger, you're dealing with a local orthopedic issue. Well, your own fat or bone marrow might be enough. Then we have that if you're older, you have systemic inflammation, your own cells are weak, umbilical cord MSCs might be a better fit. And then if you're offered embryonic or iPSCs in a clinic, that's a major red flag. Just run away, do not get those stem cells. If you're being sold amniotic or placental stem cells, know that yes, they can help you, but these are really growth factor products, not live cell transplants. Great as an adjunct, but not a cure-all. So thank you for watching. This concludes video number 2 in our stem cell series. In the next video, we're going to break down something even more critical, which is how the stem cells are actually delivered to you. And if you'd like everything laid out step by step, I put together a full patient guide. You can find the link in the description. And yeah, don't forget to like and subscribe so you don't miss the rest of the series. See you in the next video.